Polycystic ovarian syndrome (PCOS).
PCOS is the most common problem amongst young girls in this era. Stressful and sedentary lifestyles are the major culprits. It is a syndrome marked by amenorrhea, hirsutism, and obesity associated with enlarged ovaries having multiple cysts. It is characterized by excessive testosterone production by ovaries mainly. Ovaries are enlarged and there occurs presence of multiple, more than 12 follicular cysts measuring 2 to 9 millimeters in diameter. Patients complain of increasing obesity, especially abdominal obesity, menstrual abnormalities, infertility, presence of hirsutism, and acne. The patients also develop insulin resistance and are more prone to diabetes. Treatment is case-specific. The focus is on weight reduction, balanced diet, yoga, and exercises. Medications might provide symptomatic relief. Infertility may be overcome by assisted reproduction.
Fibroids.
Fibroids are the most common benign tumor of the uterus and also the most common solid benign tumor in a female. At least 20% of the women at the age of 30 have fibroids in their wombs. Fortunately, most of them, 50%, remain asymptomatic. These are more common in women who have no children or in women who became infertile after one child. The prevalence is highest between 35 to 45 years of age. Symptoms include heavy menstrual bleeding, irregular bleeding, dysmenorrhea and infertility, and painful sexual intercourse. Recurrent pregnancy loss in the form of miscarriage or preterm labor, lower abdominal or pelvic pain, and abdominal enlargement. Management is mostly surgical, and the surgery may depend on the age of the patient and the severity of the condition.
Endometriosis.
Endometriosis refers to a condition where the lining of the uterus endometrium is present in abnormal sites, such as the muscle layer of the uterus, ovaries, tubes, and occasionally beyond the pelvis. Symptoms include painful periods, painful sex, excessive vaginal bleeding during and in between periods, infertility and nausea, diarrhea or constipation and tiredness during periods. Once the condition is diagnosed, treatment includes pain medications, hormone therapies such as birth control pills, patches and vaginal rings, progestin-only pills, and danazole, a synthetic steroid. If medical treatment fails, conservative surgery might be needed to remove the endometriosis tissue. Assisted reproductive methods help women with infertility. In severe cases, removal of the uterus hysterectomy might be performed as a last resort during the reproductive years, since pregnancy cannot occur following hysterectomy.
Pelvic inflammatory disease.
It is a disease of upper genital tract. It is a spectrum of infection and inflammation of the upper genital tract. Organs typically involving the uterus, fallopian tubes, pelvic peritoneum, and surrounding structures. It constitutes a health hazard, both in the developed and developing countries. It is a major problem in the reproductive health of young women. Risk factors include menstruating teenagers, multiple sex partners, absence of contraceptive pill use, and previous history of pelvic inflammatory disease. IUCD users, an area with high prevalence of sexually transmitted diseases. Symptoms include lower abdominal and pelvic pain, fever, lethargy and headache, irregular and excessive vaginal bleeding, painful sexual intercourse, abnormal vaginal discharge. Management includes intensive antibiotic therapy after finding out the causative organism.
Vaginitis.
It is the infection and inflammation of the vagina. It is very common during childhood, as there is lack of estrogen. Estrogenic vaginal defense is lost, and infection occurs easily. The most common cause of vaginitis during reproductive age Group is infection by microscopic organisms. Trichomonas vaginitis is caused by organism Trichomonas vaginalis. There is sudden profuse and offensive vaginal discharge, irritation and itching around vagina, painful urination, and increased frequency of urination. The discharge is thin, greenish-yellow, and frothy with a very bad odor. Treatment is tablet metronidazole to 100 mg thrice daily given for 1 week. Candida vaginitis or moniliasis is caused by organism Candida albicans. There is vaginal discharge with severely intense vulvovaginal itching and painful sexual intercourse. The discharge is thick, curdy white in color and in flakes, often adherent to vaginal wall. Treatment includes the use of drugs like nystatin, clotrimazole, or miconazole in the form of either vaginal cream or pessary. 1 pessary is to be introduced high in the vagina at bedtime for consecutive 2 weeks.
To watch more, subscribe. For watching, thanks.